This is Jen here with Status Quo, where Senator Bernie Sanders has just spoken at Hahnemann University Hospital, talking about the impending closure and also talking about Medicare for All and his plans. I assume you guys work here for the hospital. What are your roles? What do you do?
We're all gastroenterology fellows.
Awesome. And your name?
Jen Schwartz.
Kirti Shah.
Samia Faruqi.
And let's take a look at your signs. Hahnemann hostages, free our funding, trainees cannot be sold, and release trainee funds. So I assume you're talking about the fact that, what is it, 500 residents now have no home. Talk a little bit about that, or about your specifics.
So Tower Health has put in a bid to buy all the Medicare CMS funds, which Hahnemann owns. So we're slated to go to Tower Health Institute, which is being perceived as a savior for us, but that's not what it is. Drexel, Tower Health, and Hahnemann have acted in bad faith and in secrecy, and are trying to sell us trainees to institutions that do not have the academic capabilities to run a training program that's adequate, nor the means to do so. And right now our funding is held up in bankruptcy court, and we cannot be released to our new trainee programs.
Does anyone want to expand?
And what we're really concerned really is about the 560 residents and fellows whose education and well-being are put to test in this process. It's not that we're not thankful that, they're planning on starting new residencies and fellowships. It's just they don't have the establishment to educate all of us appropriately to enter the workforce, and that's a huge concern for training physicians.
Absolutely. How about you? It's okay, whatever you want to talk about.
I think they said everything I wanted to say, but yeah, in a way we're being held hostage here in a training hospital that's falling apart, and we're losing valuable time to learn skills in our training. And most trainees around the nation are continuing their training right now, and we're working in an empty hospital, and we just want to get better training somewhere else.
What I've heard from a lot of people is that all of it just feels very unfair. I've heard the name Joel Friedman invoked quite a lot today in a very negative way for good reason. Private equity guy who bought the hospital, and what it seems like is he bought it in order to do this, in order to turn this into potential condos or a hotel or whatever, it's prime real estate, not thinking about the people who attend or who are residents here, who train here, who are doctors here, nurses here, staff here, and about the people in the community. Speak on that. What are your thoughts on Joel Friedman and what he's done?
I mean, he's a greedy coward, to put it simply, but he's not the only one who is to blame here. Yeah, he was the president. However, there are multiple forces behind this, Drexel and Tower Health included, and they're not being held accountable for their actions either. This is just an example of why you shouldn't have for-profit hospitals owned by someone who has no medical background and no stake, and really acts without regard to the community it's serving and the people who are serving them.
I think everyone here has kind of put it pretty eloquently. There's thousands of people that are going to be put out of jobs, and I know many places around the city are trying to absorb as many people as they can, but it's hard. It's a huge number, and it's pretty unfair. I think that's a great way to put it. It's very unfair for what's happening to the system. But like she said, he's not the only one to blame. There's a lot of entities before Joel Friedman and during his time here, unfortunately, that are at blame as well.
Yeah, I think Hahnemann kind of is in the nation's safety net hospitals, kind of like Grady or Charity or Cook County in Chicago, and now we're losing a really valuable asset in Philadelphia that's going to affect a patient population in the other hospitals in the area. So I think this effect is bigger than most people realize. It goes beyond just us and our training. It goes to all the nurses and, most importantly, all the patients and everyone else that works here besides the nurses.
Absolutely. During his speech, Bernie Sanders talked about funding for a situation like this. What are your thoughts on that potential funding? I know people in the crowd were kind of like, oh yeah. What are your thoughts as people who are in this field?
So I think it's a good safety plan for situations like this. I mean, a GME closure this large, a hospital closure this large is really unprecedented. I fear it might be too late to help Hahnemann in this scenario. I think that the forces that be would have had to intervene a little sooner. But maybe a miracle can happen with that. I don't know.
Yeah, I kind of agree. I think any funding at this point might help it stay open maybe a few weeks, maybe a few months, but at this stage, with all the people that have left, all the staff that's found other jobs, I think there's been a serious brain drain. I feel like to get it back up to where it once was is going to take a miracle.
Yeah, I pretty much just echo what they said. I have nothing really else to add.
Well, a lot of people talk about the for-profit healthcare model in general, and this hospital is not turning a profit. It's in a very poor area. The majority of the patients who come here, I believe, are poor on Medicaid, Medicare. I lost my train of thought there, but what do you think about the for-profit healthcare system versus a Medicare for all? Bernie obviously is a Medicare for all advocate.
I think it's nearly impossible to have a for-profit hospital in a community filled with underserved and a highly vulnerable population.
Yeah, I kind of echo the thoughts on it. There are other for-profit hospitals that cater to this similar population that all have very similar issues. They're also struggling to stay open. I think it's really hard to keep a hospital afloat that way in this type of demographic.
Yeah, I think the for-profit interests are very different than our interests as healthcare providers here at this hospital in terms of providing healthcare to indigent population and Medicaid patients. And I think for-profit hospitals kind of work against that, and they're not on the same page the providers are.
Absolutely. Any last thoughts from you guys? Any words you want to leave the audience with?
Release our funding.
We really want our voice to be heard. I think it's rare for the residents and fellows to have spoken up so far and talked to any of the media outlets. We really want our voice and what we want to be heard, which is that our funding has to be released in the bankruptcy courts. We would like a voice in where we go and a choice in where we go, and we would like to continue our education without threat.
I think she said that perfectly, yeah.
Absolutely. Thank you guys so much, and good luck.
Hope you enjoyed that last video. Hop on over to statusquo.com where you can sign up for our email list and become a member for as low as $5 to $10 a month. Membership is how we grow. That's statusquo.com/join. And remember, join our email list so we can grow the revolution with you.